Hi, I'm Akhil Anand, and in this short session, we'll look at alcohol's impact on health, especially its link to cancer, through real-world cases. Even though most people know alcohol can damage the liver, you realize it's a leading cause of preventable cancers. So this video will show how to discuss these risks in everyday practice using brief, evidence-based counseling approaches. So here you can see the Surgeon General's advisory on alcohol and cancer risk. One of the most important takeaways is a statement at the top. There is no safe level of alcohol when it comes to cancer risk. This is not meant to be alarmist. It reflects decades of epidemiologic and mechanistic evidence showing that alcohol increases cancer risk in a dose-dependent manner, and that even low levels of use carry measurable risk. In the United States, alcohol contributes to about 100,000 cancer cases and roughly 20,000 cancer deaths every year. Despite this, fewer than half of Americans are aware that alcohol is a carcinogen, which is part of the disconnect we see clinically when talking about alcohol's health effects. The advisory also emphasizes that even one drink per day increases the risk of breast cancer, as well as cancer of the mouth and throat. The risk continues to rise as consumption increases. The graphic shows global data from 2020. Over 740,000 cancer cases worldwide were attributable to alcohol. What stands out is that a substantial portion of these cases occur among people drinking at what many would consider low or moderate levels, less than 2 drinks per day. Because so many people drink at that level, the total number of cancers from moderate drinking is similar to the numbers caused by heavy drinking. The message for patients is straightforward. The safest level of alcohol for cancer prevention is 0, and any reduction in drinking helps lower risk. Alcohol is classified by both the World Health Organization and the International Agency for Research on Cancer as a Group 1 carcinogen. That is the same category as tobacco, asbestosis, and ionizing radiation. Importantly, the cancer risk increases in a dose-dependent fashion, meaning that the more someone drinks, the higher the risk. The infographic breaks down why alcohol causes cancer into 4 key biological mechanisms. First, alcohol is metabolized into acetaldehyde, a highly reactive compound that directly damages DNA. This is one of the most well-established pathways. Second, alcohol increases oxidative stress, generating reactive oxygen species that injure DNA, proteins, and cell membranes, and also drive chronic inflammation. Third, alcohol alters hormone levels. For example, it raises circulating estrogen, which can promote breast cancer development. And fourth, alcohol increases absorption of other carcinogens by making tissues more permeable and by dissolving harmful compounds more readily. All 4 mechanisms work together and help explain why alcohol is a major risk factor for multiple cancers, including breast, colon, liver, esophageal, and head and neck cancers. The takeaway for patients is simple. Again, any amount of alcohol carries some level of cancer risk, and lowering intake reduces that risk. Let's walk through the first case. This is a 48-year-old woman who drinks a glass of wine most nights. She believes it's heart healthy, and she mentions that her mother had breast cancer. This is an incredibly common scenario that you must see in your clinic. The counseling goal here is not to scare her, but to gently raise awareness that even moderate drinking increases breast cancer risk, especially in a woman with a family history, and then to reframe cutting back as a preventative health choice, not a moral judgment. The core teaching point is that risk starts to rise around 1 drink a day. On the right side of the image, you see the absolute lifetime risk of breast cancer increasing from about 11% in women who drink less than 1 drink per day to 13% at 1 drink a day and to around 15% at 2 drinks a day. These seem like small numbers, but when you scale this across millions of women, it is a real population impact. For individual women, even reducing 1 or 2 weekly drinks meaningfully lowers risk. So you can say something like this to this patient. You're right that red wine has been linked with heart health in the past, But newer evidence shows that even small amounts increase breast cancer risk. Cutting back, even skipping a few nights each week, can make a real difference over time. This approach validates her perspective, presents the updated evidence, and empowers her with a simple, actionable step. Case 2 is a very different profile. This is a 28-year-old man who binge drinks on weekends, usually 6 to 8 beers at a time. He feels healthy and doesn't see this as a problem. This scenario is incredibly common among young professionals, and many don't realize that binge patterns carry their own risks, even if they don't drink during the week. The counseling goal here is to link binge drinking to cancer risk and broader chronic disease, especially liver and colorectal cancers, and then offer simple harm reduction steps. A few core teaching points. First, heavy episodic drinking causes a sharp spike in acetaldehyde, the same carcinogenic metabolite we talked about earlier. Those spikes create bursts of DNA damage, even in people who drink only once or twice a week. Second, men who sustain binge drinking pattern have higher rates of liver and colorectal cancer, both of which are strongly tied to cumulative injury and inflammation. Third, we know from population data that alcohol-related cancer deaths shorten life by an average of 15 years, which is striking for someone who feels otherwise young and healthy. The graph on the right reinforces that cancer risk scales with volume, but it also reminds us that harm isn't limited to daily drinkers. Many cancers come from people in the low to moderate range simply because they binge drink. To make this concrete for this patient, we may say something like, even if you only drink on weekends, those higher doses can still cause changes in your liver and colon cells that raise future cancer risk. Reducing the number of drinks or spacing them out lowers that risk. This frames the discussion in terms of health protection, not judgment, and gives them a clear, achievable next step. Case 3 focuses on a 62-year-old man with alcohol-associated cirrhosis, who's now in remission. He has done a tremendous amount of work to cut down, and he asks whether switching to low-alcohol beer would be safe. This is a question that I see in my alcohol liver clinic. The counseling role here is to reinforce that any amount of alcohol still maintains some cancer risk, and to highlight that full abstinence gives him the best chance of preventing further liver disease progression and reduces cancer risk. The key teaching point is that alcohol is a carcinogen regardless of type. Wine, beer, spirits, even low alcohol versions. They all metabolize to acetaldehyde. So while low alcohol beer might reduce intoxication, it doesn't eliminate the carcinogen. We also know that quitting or reducing use over time meaningfully lowers the risk of oral and esophageal cancers, which are especially relevant for people with long-term alcohol exposure. And in cirrhosis, any alcohol, even small amounts, increases the risk of decompensation and hepatocellular carcinoma. On the right, the graph shows that cancer risk rises with intake for both men and women. For men, lifetime cancer risk increases from about 10% with very low drinking to 13% at 2 drinks a day. For someone with cirrhosis, the margin of safety is even narrower. So you could say something like this to this patient. Even low alcohol beer still produces acetaldehyde, the same compound that damages DNA. Your best option is to stay alcohol-free. Every alcohol-free month helps your liver and reduces the cancer risk. This reinforces abstinence in a non-judgmental way and connects the message to his long-term health goals. So this section, I just want to talk about how to communicate the message clearly. The goal is clarity, simplicity, and empowerment, not fear. So on the left, you see simple action-oriented messages. These are short phrases that land well with patients across ages and backgrounds. So things like, Small changes in drinking can make a big difference in your health. Less alcohol means less risk. Every alcohol-free day gives your body time to repair. There's no safe amount, but there's always benefit in reducing, etc. On the right are example conversations you might have. These are built around realistic patient statements we hear all the time. So when a patient says, I just drink on weekends, a simple validating response might be, less alcohol means less risk. Even getting back some weekends protects your liver and colon. If a patient says, I've already cut down a little, you can reinforce progress by saying, that's great. Every alcohol-free day gives your body time to repair. And for older adults who worry it's too late, a reassuring message could be, it's never too late to lower your risk, starting today. The theme across all of these is the same. Keep it simple, keep it supportive, and make the message actionable. So to wrap up, there are 4 main takeaways from today. First, alcohol is a proven cause of at least 7 different cancers. This is well established across multiple international agencies as information that most patients have never heard. Second, risk begins even below what we currently consider moderate courage levels. Even small amounts, a drink a day, or in some cases even less, contribute to measurable increases in cancer risk. Third, we should integrate alcohol risk education to any preventative or chronic care visit. It doesn't have to be long or complicated. Simple, clear statements help patients make informed choices. And finally, normalize the topic. Most patients have never been told that alcohol is a carcinogen. When we talk about it in a matter-of-fact, supportive way, it becomes easier for patients to ask questions and consider change. If clinicians consistently deliver these brief, evidence-based messages, we can meaningfully shift awareness and help patients reduce risk over time.